Welcome to the Darcy Wellness Show, where we present information on complementary and alternative medicine. Today's topic is women's health, and we're going to be discussing this with our panel of wise women here. Dr. Judy Dempewolff, licensed therapist, Betty Wu, acupuncturist, Po Darcy, my wife and partner in the Darcy Wellness Clinic in Natick, wise woman extraordinaire. So we're all here today to talk about women's issues. So Po, we're going to kick off with the Western tradition of the wise woman.
There is a tradition of healing among women, from women to women, that's considered the wise woman tradition. And in this tradition, there would be sort of different phases on how you would approach a woman's health issue. And the first 1 to 3 phases of that would be, really just collecting information, talking to other women, taking some rest, doing things that are very nurturing and nourishing for yourself. And then if things are still out of balance, then you would go and maybe get some help from some kind of energy medicine, acupuncture, herbal medicine. And
so
then
this is a herbal tradition
this
that's
is a
live
tradition,
and well
yeah.
today,
And then,
probably from Northern Europe originally.
That's right. So it's really about women's accessing their own intuition, using other women. And then and only then going to something that is more, if you need pharmaceutical help or surgery or anything like that. But first and foremost, you would really access your own kind of wise woman inside yourself.
Right. It's interesting, if we go to our first slide of the day, within traditional Chinese medicine, there's the menstrual cycle. Actually, our next slide, the menstrual cycle is controlled by moon cycles. So the idea that, as this slide shows, first we have at the bottom we have the moon cycles, then we have the ovarian hormones, egg development, uterus lining, and pituitary hormones, and we can see them day by day. And obviously in the middle, everything is surging towards fertility, and then it starts to ebb away. But at the bottom, we can see that the idea of the peak fertility is at the full moon, and the period should be on the new moon. Now, menstrual cycles being regulated by moon cycles is nothing new. Most cultures have noticed this, and so the idea that a period, a menstrual period that's in harmony is one that ovulates on the full moon, and in the new moon, the period begins. So there's this idea of this energetic development that we're regulated by the electromagnetic flows, the enormous electromagnetic pull that the moon would have on the earth, and that this ties in on a hormonal level. So Betty, as an acupuncturist, in your practice you must see a lot of menstrual irregularities, a lot of period problems, PMS. Have you noticed a correlation with the moon cycle?
Yes, most women who come in have problems with PMS, menopause, or one of the big thing is what TCM perspective is stagnation.
So traditional Chinese medicine, yeah.
Right, liver qi stagnation they come in with. They don't really come in for women's health. They'll come in for a problem, and we uncover, or I uncover the liver stagnation, and then symptoms manifest such as PMS, dysmenorrhea, cramping, clotting, and what have you, or they'll come in specifically for infertility. And then we will have, the basic principle is to regulate qi and blood.
So a lot of, for instance, let's say that, the menstrual cycle is painful, is blocked, and just before the period, that would be because there's a stagnation of energy from a traditional Chinese viewpoint.
Correct.
And you would select acupuncture points that would help to release that flow. And,
to regulate the qi in the blood, because it's blocked. When it's blocked, energy can't move smoothly in that area.
Right. And it's very common. I mean, it's amazing to me the amount of women and girls who have enormous problems with their periods, and lose 1, 2, 3 days every single month, completely immobilized with such pain and strain, and will just take Advil or take some sort of pain reliever and not really get to the root cause of the problem.
Right.
So, Judy, in your own practice, you see a lot of adolescent issues, and oftentimes there are eating disorders that are associated.
Yes, certainly anorexia is the most extreme of eating disorders.
And that's often associated with lack of a period, right?
Right, it's nature's way of saying this body can't produce a baby.
Right.
So we're going to just shut it off entirely.
Right, just because there's no nutrients going for themselves, much less to help make a baby.
Absolutely. So with anorexia especially, there are a lot of underlying emotional issues that the girl, typically it's female, she is not looking at. She's often the kind of girl who is a perfectionist, the good girl, but underneath there's a lot of anger, maybe about her expected role as a woman, maybe about parents expecting a lot of her. So my work is to get below the surface of food, eating, not eating, as well as getting the...
So this is really looking, you know, at the Darcy Wellness Clinic in Natick, the idea of looking at an issue like amenorrhea, where there's a lack of a period that could be, you know, there could be underlying lack from a traditional Chinese viewpoint of blood. And if there's an issue that's really blocking nutrition, then you would get involved and work on counseling on why their nutritional self is being blocked, why they're not looking after themselves.
Emotionally,
issues.
Absolutely. I mean, even excess exercise can stop the...
It's very common in athletes to have a lack of a period.
Absolutely.
If we could go to our next slide. So generally speaking, you know, as we move through the progression of young to old, the idea of you know, a healthy period is one without any PMS whatsoever. Is totally smooth. There is a period, you know, amenorrhea being the lack of period, and then when the period arrives, dysmenorrhea, it shouldn't be painful. It shouldn't be filled with cramping. And you know, some of the ways of working with that we have, you know, in natural medicine are acupuncture, herbal medicine, exercise, relaxation, and getting to root cause issues. So on a nutritional side, you know, when you work with young women in nutrition, there's a lot of deficiencies going on. What do you commonly see?
Yeah, typically with adolescent girls, due to the nature that they're adolescents, there's usually irregularity in their eating patterns anyway. They're either eating on the run, they don't have enough time to sit down to a meal, or they're eating food that's fast food, junk food. So right there, from a nutritional standpoint, there's a deficiency. So what I would work with a girl would be to just look at what you're eating. How can we get some routine into your day or your week so that you're actually, you know, eating in a more balanced way? Typically, a lot of PMS symptoms include food cravings, and usually that's because of some out of balance symptoms. So I would encourage, you know, trying to avoid the sweets, really focusing on protein and vegetables, you know, eating healthy grains, healthy carbohydrates, staying away from caffeine. I mean, it's not just young girls, it's also young women who are facing these issues. It's ongoing.
So there's a lot of societal pressure. You have to look thin. A lot of the teenage girls are maniacal about it.
And they're just not eating enough. I mean, you know, especially during the period, I think there's this, you know, constant barrage of, you know, you've got to eat, you know, not eat a lot when you're a woman, but during your period, just before your period, you need more nutrients. So, you know, you can do that with supplements. You need to support your iron because of your loss of blood cells. Calcium in particular, zinc, magnesium. So a good supplement for girls is a really good idea in young women.
And so, you know, these girls are under enormous pressure, you know, from their cliques at school. They have to, you know, look thin. They're often involved in eating a lot of junk food, so the nutrition's not there. Then on the emotional level, you have the irritability and anger that comes forward with PMS, which is often, in terms of traditional Chinese medicine, the liver energy, when it gets stuck, is connected to emotions, especially irritability, depression, anger. So these kind of go hand in glove, and in your practice, you've helped people, right, Betty? Helped a lot of girls and women with PMS.
Most girls who come in start really with the spleen deficiency first,
Yeah.
and then the spleen then insults the liver. And exactly what Poe is saying, in terms of the diet, in terms of their pressure, all of that will weaken the spleen.
Yeah.
And then that then cycles into the liver, and then the liver becomes stagnant, and therefore emotional irritability, PMS, all of that manifest.
Right,
And then now the child or the woman is, I don't know what to do.
Yeah.
So where do
Yeah.
I find answers?
Right.
Or the mother will try to find answers for
Right.
these kids who, you know, are dealing with.
Although a lot of, you know, girls are not really mentored in, you know, in their having their menstrual cycle or any issues. It doesn't. It seems like it's common, Judy. Wouldn't you agree that they're not really being mentored by their mothers or aunts or, you know?
Yeah, I think it's more in our culture a burden.
Yeah.
So witness pharmaceuticals now having
Right.
no period for 6 months, pills, which I find really appalling.
And then you were saying earlier about the Prozac being
Oh yes, right.
remarketed.
Yeah, Prozac has been repackaged as Sarafem, which is a drug that's given to women for PMS.
Yeah.
They take it for 2 weeks, they're off it for 2 weeks. Most women don't realize it's Prozac.
Yeah, that's scary. So they're taking,
scary.
They're taking and the whole medicalization
Yes.
of, you know, okay, you
Women's
skipped your period,
problems.
or the whole medicalization that this is not a natural cycle that needs to be fine-tuned. It's rather that it's a problem that needs
It's a
drop.
problem needs fixing.
Yeah. So if we could go to our next slide, we're kind of moving along the age line here and into fertility issues. So, Betty, we were talking earlier about this study that showed assisted reproductive therapy having increased success on the group that used ART plus acupuncture versus the group that didn't. How would you explain some of those? How would you explain those improved results? At 15% more success with the acupuncture group versus without?
Well, I can refer to a patient of mine who had secondary infertility. And she was doing the ART method, and she came in to complement what she's doing with her medical doctor. And she's now, I want to say 30 weeks pregnant.
Wow.
And how did we approach it with her? She was under a lot of stress, anxiety, trying to get the second child. So with a lot of manifestation of irritability, a lot of the liver qi stagnation symptoms.
Yeah.
So how do we address that? We basic principle again is to regulate qi and blood. So for her, we're trying to unstagnate the qi so that you know, she can more effectively support the method that she was using. Right. And also kidney deficiencies, she also had a little bit of that because it's never black and white.
So the kidney energy deficiency.
Kidney energy, right, as well as the liver.
Conventional medicine looks at the kidney, it's more energetic deficiency.
Right.
Yeah.
So we address actually both the liver and the kidney.
Yeah.
You know, in terms of acupuncture, she did not use herbs, although herbs is very effective, but they tend not to want to do herbs, 3 things at once.
Yeah.
Pick 2.
Yeah.
And again, she's, you know,
that's pretty significant, that
successful.
German study showing 15% increase in fertility of those that used assisted reproductive therapies and acupuncture versus those that didn't.
Right.
And there was also a study out of the Deaconess with Beth Israel where they showed that just simply relaxation, 20 minutes a day over a 5-week period for a group of patients undergoing ART, and the addition of the relaxation had a higher incidence of success than the regular group. So the idea then is that the energy opens up, and in terms of Chinese medicine, there's a whole energy meridian that wraps around the uterus and supplies energy, and there's one that supplies blood. So the idea is if this energy is blocked or not moving, then the uterus is not getting the nutrients it needs to support the first few moments of life.
Right.
So blocked energy again. And it's interesting that just relaxation is enough to increase blood flow into the uterus.
Oh, they love that, your body scan.
You
know, when they're in there, I put the CD on with the treatment, and you know, their anxiety goes down, they're calm, they come back in a better mood, and everything is smooth internally.
I've had patients too, just with herbs, where you've introduced a herbal formula, called blood mansion that helps the energy, helps to increase the amount of blood, especially over hundreds of years. This formula was developed to help nourish the blood around the uterus, and just that one change in their program was enough to for them to conceive. They had unable to conceive for many years.
Yeah.
The only thing different they did was introduce the herb. Right. So there are many ways that the natural therapies can also help with fertility. So if we could go to our next slide, we're moving up the scale into menopause, and there we have a woman. Hot flash treatment, golf course water hazard. So the idea of hot flashes, Judy, maybe you can kick off. Tell us a little bit about hot flashes.
I think that's funny.
I can relate.
It says that most women will spend 1/3 to 1/2 of their life in menopause. It is now, as we live longer, the idea of the time period spent in menopause is growing.
Yes, and I think a lot of women aren't prepared for that. They don't know that it lasts a good chunk of time, 10 years, 15 years. And emotionally, women are dealing with children leaving home, dealing with aged parents. I have a lot of clients who are, besides a full-time job, dealing with aged parents. When children leave home, suddenly a couple will look at one another and say, "Who are you?" Right. So it involves,
what are you
doing in my house? And so it involves some couples renegotiation and rebirth in a way.
So there's a lot of readjustments, a lot of life changes, all kind of converging in the same phase.
And a lot of women have to find a new purpose for themselves, whether it's art or music or maybe a creative outlet that they haven't had time for, which helps direct some of their energy. Yeah,
I'd love the traditional Chinese way that they hold menopause, and it is that the energies of the blood flow to the uterus and the energy of the conception vessel, energy flow to the uterus, shut down. Yeah, and the energy starts to then come upward, and its ultimate goal is that energy over years is heading towards the heart.
Absolutely.
To nourish the heart for spiritual growth. So then a spiritual path can be refined and grow. And on the beginning of that journey to the end of the journey, there's a lot of emotional materials that have to be cleared out of the way. And there's a strong school of thought now, on PBS we have that woman, MD, who gives a very similar analogy of her experience dealing with menopausal women and the issues that come forward that mirrors almost exactly the traditional Chinese experience. So a lot of the clearing of the emotional material, a lot of growth, a lot of awakening, a lot of pain. Who are you and what are you doing in my home?
Absolutely.
And why have I put up with you this long?
Couples have to find new areas of interest they can share. It's a matter of moving out of the parenting role and moving into couplehood in a different way. Yeah. So there's a lot of learning, a lot of experiment. It can be very exciting.
Yeah, a huge opportunity for
absolutely.
growth.
Absolutely. Yeah.
Now, Poe, nutrition at this phase?
Nutrition at this phase, it's the same really as nutrition all along, that if you start eating well early and really start nourishing yourself early, your fertility issues will improve, your pregnancy will go smoother, and then subsequently as you move into menopause, your menopause will go smoother. I mean, it's just the way of the body, So if
those resisting issues have a tougher time.
Yeah, and then for those women who say haven't been so good about their eating habits, what do? So your symptoms most likely will be more severe, but you can support yourself now. Yeah. Same thing. Make sure you get protein, more iron, calcium. Calcium is best absorbed from food sources at this age. There's a whole understanding now of not just strong bones, but flexible bones. Yeah. And in order to get flexible bones, it's not just about calcium, it's about the other minerals. And the best source of other minerals would be like nettles, oat straw, herbal sources, and leafy greens and nuts. So really checking in with your diet. Again, eating moderately. For women, they don't need to eat as much, but they need just as many nutrients as men. So they need more nutrient-dense foods. Yeah. So they really need to think about how they eat.
But going to the whole idea of the wise woman, you know, in traditional Chinese medicine, there's this concept as the energy progresses, you clear emotional issues, spiritual growth begins. You're able then to give back to the tribe, to mentor younger women, younger mothers through some of these issues, to mentor, you know, young girls just coming into their menstrual cycle. So the idea, you've been involved in a women's group for many years.
For many years, yeah. It's been a huge resource for me, and I find particularly at this stage, talking to other women, I mean, it's really the best way to understand menopause, because it's unique and different for every woman, but we can all learn from each other. Unfortunately, the medical establishment really wants to categorize it as a disease, which it absolutely is not. Right. It is a passage, and
then they're
all
marketing
passing through
estrogen
it together.
At least increased breast cancer incidence, you know, the chances of breast cancer by 1/3.
Yeah.
So thankfully we pulled back from the brink there. So there are a lot of different symptoms that are associated with menopause. Maybe we could have a quick look at the list of horrors right here. Actually, the next one. But there's a scary thought. 60 million women will be close or complete with the transition of menopause by 2010. 60. That's a major part of our population.
Yeah. That's a powerful group coming in.
There is. Powerful women with a lot of growth.
Yeah.
Right?
Creativity.
A lot of give back to society, a lot of wisdom, a wise woman tradition. So we just flicked through the list of horrors there. So one of the high risks is the cardiovascular system. That women die more than men of cardiovascular disease, and part and parcel because estrogen helps to break down cholesterol, and cholesterol, as estrogen fades away, the ability to do that declines, and so we get women with a lot more cardiovascular disease. The list of horrors, just for some of the hot flashes, vaginal dryness, water retention, fat and weight gain, especially in the hips and abdomen, sleep disturbances, headache. There's a lot of varied changes that happen to the body when estrogen recedes. And the cardiovascular system is our next slide, showing that you know, exercise is even more important at this phase. You know, as the cholesterol chances are to increase. That's Betty doing a yoga pose.
Actually, that's Poe.
Poe, yeah. So the studies show that menopause have higher levels of triglycerides and cholesterol. So foods to help that, Poe? Even more important to stay away from junk food?
Even more important to stay away from junk food and unhealthy fats, but really incorporate the healthy fats, essential fatty acids.
Too, you know?
Animal protein in moderation, absolutely.
I mean, the China study information showing that animal protein increases the risk of heart disease and also of cancer, especially around 20% of animal protein. That's just not meat, that's also eggs and dairy.
And plant-based protein really can satisfy all your needs, but you know, women really need to learn. You know, it's really about educating, reading, finding new recipes, talking to other women. How can we cook, you know, to support ourselves in this next phase? It's really, it's so simple. I mean, if you look at the top 10 causes of physical problems for women, the solutions are all the same. Healthy eating, diet, exercise, community support. You know, it's really those things that unfortunately on our priority list we tend to get so busy we make those last on the list, but now's the time to bring it up to the top. Right.
So Betty, a lot of the menopausal hot flashes, I mean, acupuncture does remarkably well with.
Yeah.
Don't you find?
In terms, again, it is the basic principle is to regulate qi and blood. When you're in menopause, your estrogen is decreased, and translate that to TCM, the yin, which is blood, is depleted. So we need to nourish and tonify the yin.
So a lot of fire flaring up.
Fire flaring up, right. That's another yin, and that's why they have insomnia. Most women who come in with menopause, that's one of the things. They can't sleep, they have night sweats, they have hot flashes, at any time during the day with those symptoms. And when we can regulate the qi and blood, we can alleviate or help them with those symptoms. And then they become more productive, make more right decisions.
Because I mean, you know, just the fog, you know, oftentimes I hear of, you know, menopausal women complain of the fog
Yeah.
of, you know, the mental cloud.
Mental heaviness
clouded.
that is there, right.
Mental functioning.
And Poe mentioned nettle. Nettle
Yeah.
tea, I recommend that highly because that really helps yin.
Yeah.
And the tea is very nourishing, and it's nice to give them some things to do on their own, or things to read, things to follow, meditation, and so on.
If we could go to our next slide, because osteoporosis is another kind of progression of lacking of estrogen to fix the calcium in the bone. So nutritionally, there's a lot that leaches out that we can cut back on, right? So the idea of calcium obviously supplementing with calcium is a big deal, but sugar, salt.
The whole acid-alkaline conversation.
Acid.
You want to keep your system alkalized as much as possible, which would include eating lots of greens, keep your antioxidants up, less animal protein, which does have a tendency to leach calcium from the bones. But even more so, really supporting and nourishing yourself. You need protein, but you also really need to support that protein with the leafy greens, with the minerals, the calcium from your food, and also if you're not getting, yogurt, dairy products in moderation,
The vegan studies show also.
The vegan studies show, that
the healthiest
bones come from women who don't necessarily eat meat or dairy products. So their
so
body is utilizing it.
It's about
keeping the calcium,
as much as you can.
keeping your system alkaline,
So
keeping the chi flowing.
Judy, just in summary then, so there's a lot of opportunity each of these phases really for growth and to really able to give back that growth to society, to
personal
younger women.
exploration. And creativity, definitely.
Excellent.
Yeah.
So if we go to our final slide, if you care to read more about women's issues, there are articles on the website. There's a menopausal herbal program, especially hot flashes, a traditional Chinese herbal formula that we've been very successful for hot flashing. And there's a list of different acupuncture studies for fertility and how that does increase. So just in summary, Poe, just quickly, is there anything that, just in a few sentences, you would encourage?
I would encourage women to, when they really need help and they feel that they're out of balance, to really explore all of the options that are nourishing and non-invasive first. Really look at yourself and your lifestyle and your nutrition.
Going back to your opening
Going
point
back
of
to the wise woman
tradition,
tradition, which is really self-awareness and talking to other women in community. And we support that.
Betty, just quickly, anything to sum?
I would say start early, start young, to keep the chi and the blood balanced, so that, as a child, young women and older, it wraps around. It's a cycle of health.
And Judy, any?
Absolutely.
Just to be aware of emotions underlying a lot of these stages and find someone to talk to about them.
Well, Judy Dempewolff, psychotherapist at Darcy Wellness Clinic, Betty Wu, acupuncturist, Poe Darcy, a nutritionist at Darcy Wellness Clinic in Natick. We want to thank you all very much for joining us today, and we hope that we've offered you some natural, non-toxic remedies that you can think about trying before you might try some more invasive or more pharmaceutical options. And from us at the Darcy Wellness Clinic, thank you very much for joining us tonight, and all the very best for your health.